So I don't think it's by default.
Okay.
Okay, so we are live now. We are recording. I think maybe we can start this meeting. It's challenging for me because I'm checking like whoever is entering the room and making sure I have them in the list. So, but thank you so much, everyone, and especially given the circumstances from the previous Zoom meeting. So thank you so much for making the time today. It would be great if you can show your camera today with us, if possible. If you are to ask questions, please use your headset or earphones because I will minimize echo. Also, adding your name will help to identify you, and raise your hand with the little icon on the top when the question time arrives, please. So as I just mentioned, the meeting is being recorded. And it will be posted later on together with the slides in YouTube so that you can disseminate it. We really hope that today we can explore the Lupus100 project and beyond, as you will see. This project is one of the EURORDI's 2025 Patient Partnership Good Practice Challenge winners, which showcase outstanding collaboration between patient representatives and healthcare providers within the European reference networks. And we are very grateful to have here again today with us Jeanette Andersen. She is chair of Lupus Europe and also patient representative at ERN RECONNET. We also have here today Eric Hashula, Education and Training Working Group Chair, among others, in ERN RECONNET. She is the General Secretary of Lupus Europe, and Alain, she's the Lupus Europe Organization Coach and EPAC also at ERN RECONNET, and they are the initiators of the project and also those that made it happen. So I'm looking forward to hear from you what you have prepared for us today. So I hand over to you.
Wonderful. Thank you very much, Nora. So we have a lot to go through today, and so I'm going to try to talk a little bit fast to get through everything. But really, you said it, we're really, really excited to share with you a little bit about the journey and some of the insights from the Lupus100 project. But to talk about what the Lupus100 project is, first we've got to start with looking at what the issue is, really. So we all know that quality of information on many rare diseases, including lupus, online is a real issue. Word of mouth, rumors, unchecked data can increase confusion, create anxiety for patients, and can lead to incorrect actions. But we all also know that patients regularly access information about their health and their conditions on the internet, and that's where misinformation is rife. So it's very important that patients have access to quality information about their condition. Patient education, it's a key part of the self-management of all chronic conditions or rheumatic diseases, and an essential component of patient education is access to valid information. To further compound this issue that's already complex, Lupus Europe experience is that most lupus patients in Europe do not know English well enough to ensure information available online can be accurately understood without a high risk for errors, really. So it's really crucial that any information on their health must not only be medically correct, but that the language used must be patient-focused as well. And to address this in the Lupus100 project, one of the very first things we looked at was patient-doctor collaboration. That was key. But Professor Hashula, maybe you could tell us a little bit about how all this started.
Yeah, sure. Lupus100 was beautiful collaboration between patient association, doctors, nurses, etc. And this was an initiative from Alain Cornet from Lupus Europe. And this project was launched in 2022. And the aim was to provide quality information on lupus, systemic lupus, online in the narrative languages of at least and possibly more than 95% of the European population. And we have our Lupus100 project now covering 19 different languages, covering more than 90% of the population in Europe and beyond. And Lupus100, the objective is to boost patient education and fight internet misinformation. And how did it start, actually? The French book, The Lupus en 100 questions, was written with a collaboration of patient association, GPs, specialists in systemic lupus, nurses, psychologists, etc., more than 10 years ago, and we did 3 different editions of this. And this was a point of inspiration of Lupus100. The project was endorsed by the ERN RECONNET, and doctors, patients, nurses, etc., worked together to create a European version, beginning of an English version. We did an English version with a group of Lupus Europe and with different doctors and a UK doctor to be sure to have the correct English languages after translation with DeepL Pro. And English version was validated by the ERN RECONNET, and all doctors worked for the final version of the English version. And thereafter, Alain came. And how did we get here now?
Right. So once we had established that English-based version, which was agreed by the doctors from RECONNET and was worked together, doctors and patients, we then started to create for each language a doctor-patient team, so a duo, that would work together on validating a DeepL Pro translation in their language. And so these translation had side by side the English text and the translation text, so that people could permanently go back to the English, make sure that it was a perfect translation. And as they were translating, they had comments. They had comments sometimes on the wording, but also sometimes on, oh, this works a little differently here, or this is more relevant for our countries than it is generally in Europe. And those comments were tracked and were then discussed with the doctors to make sure that we would keep the content being the same, but also understand the differences and use that to improve the total content. And then obviously we've put it online. So we have an internet website where all the versions are existing, and we keep track now of potential changes to be made to all versions so that it keeps synchronized. And so maybe Jeanette, you can get onto a demo of what it is online, and obviously people can scan the QR code if they want with their phone. That's going to work.
If you're quick, we can just make it. So let's go online and have a look.
Yeah.
So here you see the Lupus100 website landing page, and here you can choose the language you would like to go to. Let's go to English today. And here you can see the most popular questions at the moment, or you can actually view all the questions if you want to. And you have different categories, so lupus management, lupus manifestation, lupus challenges, or you might even write your own language. So then it should actually say, how does the disease develop? And then if you want to, you can click here and can read a more in-depth answer to your question. So this is the website.
It's a good information for patients and GPs. And what I have to say concerning the top 5 patient questions, these are not the questions coming from the doctors, but actually completely from the patients. And the most 5 questions are, what is lupus? Very important for the good knowledge of the disease. Is lupus contagious? Very frequent question asked by sometimes family of the patient. What are the different forms of lupus? What is a drug-induced lupus? Actually, some drugs may induce systemic lupus, and this is not well known. Is there a relationship between lupus and stress? So frequent question, a major problem for patients. And can I have a normal sex life, which is totally normal to discuss about that coming from the patient. I have maybe to add a six question about fatigue. This is also a very, very frequent question asked coming from the patient. So next.
So really, you've heard a little bit about the project itself, but why did this work? Why did the patient-clinician partnership in this project work so well? Well, we believe that what made this partnership work is that patients, first of all, were not treated as consultants. They weren't add-ons in this project and in this process. Professor Sulas, as you said before, this was a patient-initiated project, and patients were genuinely at the table as equals, really, with doctors. Every decision, every discussion, it gave equal weight to both patient and doctor perspectives. And that really, that sense of equality was key to the whole project. In terms of learning, again, we can't emphasize that enough. This entire process in this project, it was a mutual process. So patients gained deeper medical nuance throughout the process, but we think doctors also learned a huge amount about challenges patients face in the world and the questions that they have. And both sides worked together in ensuring the content of Lupus 100 was valid medically, but also very accessible for patients in lay language. So this was key. The work was co-led, so language validation, it wasn't done by one side in isolation. You heard Alain say this before and Professor Hasula say this before as well. This everybody worked in patient-doctor pairs across languages, across countries. Roles were defined very, very early and were clear. Everybody worked on the basis of trust, and that was built further and further through regular check-ins. Teams really worked together and stayed aligned throughout. And because there was continuous dialogue throughout this process, that meant translations weren't just technically correct, but they were also very sensitive to culture, very clear for patients in every language. And that sense of inclusion was very important. Obviously, the overarching goal, very important here as well, which is to work together to develop trusted multilingual information across disease areas, which is an aspect of what we're talking about today as well. And just to be clear here, Lupus 100 was funded entirely from Lupus Europe's general budget. We received no additional funding for Lupus 100 or for Lupus GPT, which you'll hear about in a second. And while Lupus Europe receives industry funding, there was no industry influence in the content or the development of this project, which was led by patients and doctors. So thank you, Jeanette. Going to the partnership in action, really. One of the clearest results of this partnership is the scale of the project and its reach. So today, Lupus 100, as you heard, is live in 19 languages, and that covers nearly 87% of the native languages of the European population. But we're not stopping there. We're actually taking this one step further and to enhance inclusivity even more and expanding Lupus 100 into the top languages spoken by immigrants in Europe, and that is Arabic and Turkish. One of our key strategies since the launch of the multilingual website of Lupus 100 has been to track user engagement and to try to discern, thank you, any trends or themes really that may arise. And in doing that, we wanted, and we still want, to try to identify patient concerns, key information needs people might have, and to try to explore any prevalent misconceptions, like, is lupus contagious? Since the launch of Lupus 100, now, we think this is very important, more than 169,000 people have visited the Lupus 100 website, and the 100 questions have been viewed over 1.3 million times across language versions. Now, that reach is remarkable for a rare disease resource. And it really, we think it proves that when content is trusted and accessible, people will use it. It also has to be said that Lupus 100 might be a static resource, but it's not a static project. We track usage data, and that helps us see which questions matter most and where people spend more time on the website. That helps us understand the community needs better, but it also helps us plan new content for the future. And we've got an inbuilt sort of patient and clinician feedback loop to this project, and that ensures really accuracy, clarity, relevance. All of that is very, very important. But that's perhaps theory. And let's talk a little bit about the practical recipe of how we did this. So first of all, we listened. So we leveraged the Lupus Europe Patient Advisory Network, or PAN, and we did that very, very quickly. And that's a network of trained and energized patients with lupus within the organization from all across Europe. And they work in research projects. We talked to the PAN to surface what patients across Europe actually want to know. And as you heard before, we also took the Lupus 100 questions, the French book, as a point of inspiration. We started from there too. We also talked to doctors. From those discussions and really the collective experience within the organization and its national member groups across Europe, we had a list of 100 questions people most commonly have about lupus. Then we agreed what the 100 questions would be in the text to start with. And then one master version was built in English together with clinicians, specialist lupus doctors, as you heard before. But this answering of questions jointly from both sides ensured the medical accuracy in the base English text and the lay language embedded within it. Very, very key. Then we used DeepL Pro with a medical add-on as a starting point. Draft translation, as you've already heard, so human teams didn't have to start from scratch. But to do this properly, we identified patient-doctor pairs for each language. But how did we do that? And these people work together. We identified patients through the PAN, but also through national member groups. But to identify specialist lupus doctors, we went through the SLE working group of ERN RECONNET. In parallel, we designed a translation validation process, and that was to ensure the work was synced across languages. So every time, really to ensure that that was done, every time a doctor-patient pair was identified, we had an onboarding meeting with them. And there we went through the project, the validation process, what to do, what not to do, how it works to make comments on the language, how to send through feedback on the scientific sort of content, answering everybody's questions. That didn't take a long time, about 15 minutes per meeting. And we sent slides and recording out of the meeting every time so people could look for any questions that they might have. And we were available for any questions through the process. Now, the English version of Lupus 100 went live first. And then, as you heard, a master web page was created, and that houses all language versions under the flags that you saw before. And then we built each language page individually, publishing each language version of Lupus 100 as it cleared validation. We didn't wait for all languages to be ready to go live for this project. We did this one at a time as languages were ready. We've ensured that each language page had a dedicated feedback section at the end so people could leave comments. That's very important. But we've also ensured each language page has a section where people can recommend a question they would like to see added in the future to Lupus 100. And that's a very important part of this process as well. But Jeanette, maybe you could tell us a bit about what made this possible.
I definitely can. So as you said before, this is all built on trust, transparency. It's valid information and shared values of empowerment. That's what drives this work. The belief that patients and doctors can work together to create valid information, and that when we share it, patients feel empowered. This was, as Zoe said before, endorsed by ERN RECONNET and supported by SLE working group doctors. And I think this is really amazing to see all these doctors collaborating within the ERN, helping each other, helping us identify doctors and sometimes even patients for those patient-doctor collaborative teams, which was really amazing. It was coordinated by patients. So a patient was leading this entire project, ensuring that the persons living with the experience remained at the center of this. We had, as Zoe mentioned before, a streamlined translation, a validation model, and that kept the quality and ensured the efficiency of this entire process. And it helped us, and it still helps us when we want to add more languages, that we know that we have a process that works. This was done by volunteers all across Europe, patients and clinicians as well. So clinicians were also volunteers, and they carried out those multilingual translation validations, which is amazing because if we look at the English text, that was actually 80 pages of text. So it's not a small thing. Even though they had a draft translation already done, and they only needed to validate it, it was still a lot of work. It's really humbling for us to see this process going along. So we also have a Delphi-style review to keep updates consistent across all languages. So we have a document, as we mentioned before, we gather feedback, and we have all these informations created in this document, and we send it around to both physicians and patients to make sure that whatever changes we make are consistent across all languages, and that we can really support, and we know that it's valid information we are giving. So why did this partnership stand out? So trust built the foundation. We know that patients and clinicians worked as equals, and we had genuine collaboration. So we were all at the same level. There was no, the doctor knows all the answers and the patients just need to give, I have severe lupus and I need help. This was an actual collaboration. And also collaboration delivered scale. So we have the multilingual reach, validated quality and measurable impact across Europe. And that's thanks to the collaboration, thanks to patients sharing the information, but definitely also HCPs sharing the information in their networks. And that, I think, is what the ERN is about, is that network of physicians spreading information. Adaptability empowers and ensures the future. Definitely, this is a living model, as Zoe mentioned before, that can evolve with patient needs and be replicated beyond lupus to other disease areas. So actually what the feedback that comes to us and the feedback that we get from this tool, for instance, is lupus contagious, which surprised us very much as a question that was asked frequently. We actually just recently created a campaign telling people that lupus is not contagious. And we did that on the basis of this tool. So, Zoe, going beyond Lupus 100, what's next?
Oh, this is very exciting as well. So thank you, Jeanette. Actually, Lupus 100 has a lot to do with how the idea of Lupus GPT came about. But Lupus GPT is a groundbreaking multilingual artificial intelligence tool. It is designed to provide answers to patients' questions on lupus in their native language, drawing information only from valid sources like Lupus 100. It's a completely free tool. No subscription required, no login required. We designed Lupus GPT and we did that in a way that people can choose between a standard version of this AI tool and an easy read version of the AI. And we believe that ensures maximum accessibility, really, for what this tool is. Lupus GPT is a tool that's built to answer questions on lupus in virtually any language, which we think is incredibly exciting. And really, we think that Lupus GPT is going beyond Lupus 100 from a static resource to something that has a dynamic dialogue format and can shape patient education according to patients' actual dynamic questions in the moment, which is brilliant, really. We've got you all here, so perhaps, Jeanette, you could share, yes, and maybe I wonder while you're sharing this, whether Professor Hasula can tell us if he's ever used Lupus GPT and a few words about it.
Yeah, I have to say that Lupus GPT is totally different compared to GPT. You can ask to GPT some question, but this is not the topic here. Everything has been built based on valid quality, high quality material concerning systemic lupus. And you use AI based on that material. So it's totally different compared to GPT. And what I have also to say is that each question you ask is dedicated to the patient, but also to the family of the patient, but also to the GP and some doctors who are not very aware on systemic lupus. And maybe you can make some demo, maybe asking also what is lupus, for example, in French, in English, in whatever languages you want.
Yeah, I've put in what is lupus in English. So let's see what it says. Yeah, very good answer. So let's ask it in Danish.
Yes.
And as a native Danish speaker, I can say it's the same answer, just a little bit briefer, but in Danish.
I trust you.
So what it's really amazing is, so we also mentioned it, it has this toggle on top here where you can change into easy lupus. So once it's launched, now let's ask it again, what is lupus? And we will get a similar answer, but hopefully in a little bit more condensed and with not as many fancy terms. As
More
you can
simple.
See. Yeah, more simple, exactly. And you can put in any question you want in any language you want. So do you want me to? Yeah, go ahead.
Sorry, and I have to say that I have tested Easy Lupus and Lupus GPT, and sometimes he has not the answer, but say, I don't know, ask your doctor, actually your specialist in systemic lupus. which is good. Because
Exactly.
normal GPT will find any answer, but sometimes you don't know, and you have to ask a doctor.
Yeah, exactly. Thank you, Eric. So do you want me to also mention the spoken version, or do you want to cover that yourself? So I'm not going to demonstrate it here because we have more than one microphone, but you can actually also, in a beta version, press this button and say your language out loud in your own native language, your question out loud, sorry, and then when you've pressed the enter button, it will then formulate the answer and read it aloud to you in that same language. The language depends on your browser language. So if you have a browser that's set up in English, it will give you an English language. If it's like mine, it's in Danish, so it will give you a Danish language answer. But it's also very useful for those illiterate people that we know are around the world. So hopefully it was a small demonstration that can inspire you. And we can move on.
Thank you. So, as a project, Lupus GPT was conceived really at the end of March 2024. By June 2024, it was launched at EULA Congress, and its full launch came September 2024. And really some numbers which we're not throwing out randomly. They do have a purpose, and I'll come to that in a second, is that since September 2024, which is a year, it's answered more than 44,000 questions in 118 countries. And we think that that kind of reach is extraordinary for a rare disease tool, and that it really, really shows the global need for accessible, valid information on rare conditions. Now, in parallel, you heard about Easy Lupus that was launched, this simpler language feature of Lupus GPT, and it's based off of the same library of valid documents on Lupus that Lupus GPT is. But as you saw, it pitches information to an easier language level to boost accessibility. Easy Lupus hasn't even been launched fully for a year. It's 11 months, really, October 2024. And in that time, it's answered more than 11,500 questions across 89 countries. We think that these numbers speak for themselves, not to pride ourselves, but to show that there is a global need for reliable, multilingual, patient-centered resources that give information on rare diseases. So I think that's the takeaway here. But what is the blueprint, perhaps? So the blueprint that you've heard all throughout this talk is really the first step is to create or identify reliable core content. That content has to be medically sound, but it also must be shaped by what patients actually need. Patient-doctor collaboration, that's a non-negotiable. It is essential at every stage, this co-writing, co-validating, co-refining. That's what gives medical accuracy and relevance for patients. And you need both for a project like this. Nobody can do this alone. So sharing knowledge across patient organizations, that's key. So by sharing knowledge, we multiply the reach and we get rid of duplication. And that's really key in patient organizations because resources, finances, time, capacity, all of that is tight. You've heard about AI technology, leverage AI technology. That's really important as well. So for Lupus GPT, obviously AI technology is used to power the tool itself, but for Lupus100, AI technology was used for the first translation draft, always with human validation and a lot of human work at the end as well. Accessibility is critical. Think multilingual, sensitive, sort of easy to read formats. We can do a lot to make accessible information. We cannot say this enough. Don't wait for perfection. So launch early, get feedback, refine, and iterate. Get usage data for the tool that you're making and then use it. So have feedback loops in your project and measure what's working, try to fix what isn't working, and listen to the needs of the community in that way and try to improve. These projects, especially the AI tools like Lupus GPT, they can be relatively low cost, but they can have a really, really high impact. But the model of them, the blueprint, as it were, because we're talking about tools for lupus in this webinar, but really the blueprint, it can be replicated far beyond lupus. So over to you, Jeanette.
Yes, so take action. Collaboration across patient organizations. Let's share the knowledge. Let's make sure that we make use of the collaboration options that we have. we start small. You can always start small. Have a small thing, a small library of documents or something that's this is valid information, and work up, scale up from there. Start with core content, refine and grow, as Zoe said. So let's fight misinformation. Let's fight it together. So I think this is time for questions.
Thank you so much, Zoe and Jeanette. It was great and inspiring hearing to you, also to Alan and Eric for explaining us as well how it all started. Maybe if someone from the audience has some question, I see Coralie has the hand raised. Coralie, please.
Thank you, Nora. Thank you very much for this presentation, and really congratulations on this very, very inspiring initiative. I've got two questions. The first one is a very tricky one. What kind of budget does that represent for a patient association to build Lupus100 and Lupus GPT? And my second question will be about Lupus GPT. I was wondering, because we know that Chat GPT, by example, is constantly being updated, with the novelties and the new discoveries and so on. How do you update Lupus GPT? How do you, keep on track to update Lupus GPT on real time, on daily basis? Thank you.
Go ahead, Zoe.
I wonder for the budget comment if Alan would like to take the lovely budget question first. So
Well, I can start the lovely budget question. So Lupus100 was a very expensive move. So Lupus100 was before ChatGPT existed, and so per language we can count that it was roughly about 10,000 euros as a budget, all included per language. The first language being the most expensive, and then as you grow, it's low. In there, per language, we have about a 2,000 euro donation, because when we wanted to start that, we agreed with the editor, owner of the rights on Lupus100 in French, that we would buy the rights for the various languages, and we agreed to make a payment for that, and that payment is used to improve information and projects on information on other disease areas which are close to lupus. So we are fine with that, and that helped us go very quick. So Lupus100 was an expensive move. Lupus GPT did cost us roughly 50,000 euros, but would now cost probably about 20% or 30% of that amount if other organizations would move it, because we had to learn our way through, and now we know how to do it, and we have an agency that does it. And when we had to make Easy Lupus, which was basically the same, it was much cheaper, because what they can do is to copy somehow what you have is a room in which you have an engine, which is ChatGPT, and you just log the room. What was expensive was to find how do we really close all the doors and close any possible exit that people don't even go under the door, okay? Once you know how to do that, you just copy that room and you put a different library in the room. You put different documents. So if you have the data, which is what Lupus100 largely gave us, because it gave us a number of facts and so on, if you have that data, probably nowadays for an organization to do it, you would count 10 to 15,000. One of the important things for patient groups to know is that the power of Lupus GPT is such that I think none of you will ever have issues if there is a pharma active in your sector. That's a big if. If there is a pharma active in your sector, this is the kind of projects that you probably can get funded fairly easily, because it is at the core of what they want to achieve with patient groups, is patient education. And it does patient education very well and patient information very well. So the funding is probably not a major issue there if there is at least one pharma active. The work is to work with doctors to find which documents you put in the library. And that counts for zero in our cost. But the reality is there's an opportunity cost that's gigantic. Doctors have spent hours in reviewing documents, in providing answers, in selecting documents, which article do we put in the database, and so on and so on. And that is obviously resources which are non-financial, but which matter as well. And then on the, I don't know, Zoe, you want to pick the next question or?
Sure, I can take the next question, but just to ask, and thank you for that. That was very helpful for the budget. That's always very complex. When you were asking about whether ChatGPT, we said ChatGPT is constantly being updated, which is very true, and technology changes. But you asked the question in terms of Lupus GPT. Did you mean, are we updating the large language model itself and the technology? Are we following up with the technology as it moves, or are we following up with the evolution of the documents in the back end of the GPT, or both?
No, exactly the second part, Zoe.
The second
all
part.
the new release, the scientific updates and so on. I mean, by example, all the results and data that have been presented in a EULAR Congress this year. I mean, did you put them really quickly in Lupus GPT? How do you run that? How can you stay totally and perfectly updated on new treatment, new trials, everything? That was my question.
That's a very interesting question, actually. So when we designed Lupus GPT and we designed this library of documents, the library of documents was quite small. And it had Lupus 100 within it. But one of the big challenges of this project has been how to design a process whereby doctors can select documents and keep the library updated, and where patients can be involved in the process as well. That process, I have to say, the tracking of the tool has been incredibly useful to help guide the process as well, because in the back end of Lupus GPT are two databases, and we didn't talk about them today, but we've implemented two databases, one really capturing null responses. That is the questions that you heard before. If this tool doesn't have an answer to a question, it will say so. One of the things that does is it helps us figure out where the gaps in the knowledge of the tool are, not just in the new knowledge, but in really there's a huge knowledge across Lupus. So where does this tool have gaps despite the wonderful documents that it has in? So we use the database to try to figure that out. And then we work with doctors to try to plug those gaps. But you're right, science is developing very quickly. Publications are moving very quickly. It's very important that we don't, I think, do this too fast. We can update it in real time, but very important that we do it in a way that's planned, and that we do it together with doctors, and that we involve patients so that the process sort of can be very good. I think we've done one upgrade in a year to the documents in the back end. Alain, I don't know if you want to add something to that.
Yeah, just I think what you mentioned was very important is it's not in Lupus GP that you're going to find the results that have been published yesterday about a clinical trial.
No.
And that's not what we want to have either, because what we need is to have the important information for the lay patients, and that's what's in there. And so when something comes up that is very important, like a new drug coming on the market, then we can easily update by adding one document in the library. But if we want to permanently keep current with the last minute changes, it becomes a huge task and you need a full-time person doing it. And so that's where the arbitration has to come. And that's where your first set of document needs to be consistent and answer the bulk of the questions that will be raised. And then you can select to update documents, to replace documents as the knowledge is changing, as new things are coming, and so on. And that's where, again, doctors, and including in ERN RECONNET, obviously, the participation with the doctors which are leading on what is important and new is critical to help us select, oh, we now need to add this document, which is very important, or we should remove this document, which is out of date, and replace it by something else. So that's the process that's taking place, that happy balance to find.
Thank you.
Eric?
And Coralie, the first base document was Lupus en 100 questions. And you know that we have RECONNET en 100 questions.
Yes.
We have scléroderma en question.
Yeah,
We
I
have
know.
inflammatory myopathies en question, etc., etc. This can
That's
be the place
exactly.
to go to move on.
That was the meaning of my question, Eric. Thank you. Thank you all for your answers.
You're muted, Alain.
Just building on what Eric just said, the beauty of Lupus GPT is that you don't even need to translate Sjögren 100 question. You don't need to feed it in English.
Yeah.
You can populate your data in any language you want.
Yeah.
Okay, preferably one of the big, largely spoken language. I think if you all populate it in Swahili, you're going to have more translation errors. But you can take the document, and what you can do is you can cut Lupus 100 question or Sjögren 100 questions into 20 or even 100 documents and pick, okay, these 90 ones, they're fine. I put them like that. These 10 are the ones I want to work with Eric to update them and then to put them online. And this way, you can really put the efforts as an ongoing permanent improvement to have quality information at an affordable effort for each organization.
And I can just mention one thing, speaking about the languages, Alain. We noticed when we put up the documents that were mainly in English for Lupus GPT, we quickly realized, so it automatically translates into European languages. That's great, that's fine. We also tested it again and again and again, both with physicians and with patients. Does it actually translate in an accurate way? And we had some small adjustments, but in general, it was fine. What we didn't expect was that it actually also taught itself how to speak African Zulu, how to speak Indian dialects. We have all kinds of different languages around the world that we found out by speaking to other patients and doctors that it also translates into, and it works in those languages. Not only is it translating, but it's translating in a correct manner, which means that now actually people all around the world have access to this validated information. Now, some of it is only relevant for people in Europe, but most of the things in there is universal. So what is lupus is something that's interesting for everyone, right? And it's the same answer no matter where you're from. So I think that's really interesting. It shows the capability of a tool like this.
Thank you very much. Any more questions from the audience? Otherwise, I will have one. We have Michael. Please, Michael.
Thank you, Nora. And thank you to the Lupus Europe team. I'm Michael. I'm a medical doctor in the UK, and I'm working on a very, very similar project. So using AI to help inform patients with rare diseases more about their condition, to help them in appointments as well. And my question is very simple, and it's how do we work together? Perhaps something after this call. But that's the question I have.
So first and foremost, you ask us. So send us an email. We'll give you an email address at the end of the presentation. Send us an email explaining what you would like to do, and we can start a collaboration.
Fantastic. Thank you so much, Jeanette. I thought that might be the answer.
You're right.
And also from our side, Michael, we have some frameworks on how to collaborate and some other good examples that I am happy to share with you after this call as well, so you can have a look and let us know if you have any questions.
Excellent. Thank you so much, Nora.
And great initiative, Michael.
Thank you.
Any more questions? My question is actually, you kind of touched base on it already, but I wanted to ask you, like, because this tool has been developed with patients as end users in mind, let's say. However, I wonder if you know from the data you retrieve if some other profiles also access this information. I'm thinking, for example, healthcare providers at clinic level, or can you maybe tell us more about some of these results?
Do you want to?
No, I wanted to say go ahead, sorry.
Thank you. Yes, so as we said before, there's databases. Now the tool is questions, everything, the conversations people have, all of that is private. However, it tracks keywords that people use. So that's very, very important to see general trends really in the questions, in what people are asking. But it also, as we said before, tracks null questions, questions that it doesn't have answers to. And that's really the only reason for that, is to help us plug the knowledge gaps in the tool and to help us in developing campaigns to address those knowledge gaps, etc. From those questions, the null questions, we can see some incredibly technical questions that are being asked that no patient would have ever asked anywhere. And we think there are some healthcare professionals we know from industry partners who have told us that they are using this tool within their companies. Really as an information tool, which is incredible that they're turning to this as well. But we've also heard from people doing social science degrees, etc., that they go to the tool to find information on lupus. We've had this a couple of times already, people doing masters and PhDs on around socioeconomic determinants of health and lupus, that are going on the tool to find out more information both about lupus itself, but also about funding opportunities for students, etc., which the tool doesn't have, obviously, because it's for patients. So there's a number of people who are going to the tool, which is very interesting.
Exactly, that's very interesting. Like, Janet, you wanted to comment?
I just thought of a very wonderful anecdote. So we were at the EULAR Congress this year, where I had a presentation, a poster presentation, and no matter which presentation I did at EULAR this year, I mentioned Lupus GPT because we think it's important that people know about it. And the rheumatologist that I spoke with, he was actually more interested in Lupus GPT than he was in the poster. And he said, so does this tool work in Ghanese? And I said, I don't know. So he checked it because he's from Ghana. So he checked it and he's like, it works. So I can take this home and use it with my patients, and they all have smartphones, but they can't write. But they can scan the QR code, they can ask their question, and then they can get the answer read out loud to them. He said, this is a really revolution for my patients. Now they can get real answers because they can't see a rheumatologist. We have like one rheumatologist for a couple of million patients, where here I can just refer them to this tool and they get answers, and reliable answers to their questions. And I think that was almost my highlight of the entire Congress, knowing that the lupus population for this doctor would now have this information.
That's great to see like a real impact, right, on of your work. So that's great.
That's exactly what we want.
we hear remarkable, fantastic in the chat. So, any more questions? Otherwise, yeah, we have Eric.
Yeah, not a question, just a comment. Yes, because you know probably that here in my department we have developed a patient education for years and years and years. And patient education is not information. This gives the information, but this tool can be used as a tool for patient education actually. And we have a workshop on literacy for patients. And we check on the internet some information. Patients are keeping some information on internet, and this is discussed with a nurse, with the doctors, etc. And we will use the tool for the workshop of literacy in systemic lupus.
Wonderful, great.
Thank you so much. Maybe if no further questions or comments, no? Okay, I think there will be some connections happening after this this webinar, which is always great. If you have any questions, please feel free to contact secretariat at lupus-europe.org. You have Zoe, I think, is behind this email address, very, very likely. And also, if you have some time, thank you so much, everyone, for being here. And if you have some time to go through a short feedback survey that will be great. So it will help us improve and also identify maybe future topics for this type of webinars. And before we close the session, and also mindful of the time, we don't have too much time, a quick reflection, maybe more into the theoretical side of this patient partnership, aside for the Lupus 100 project, because I wanted to highlight as well how you have used different engagement approaches at different project phases. For example, we saw in the scoping phase that you consulted your community via the Lupus Europe Pan, or in the preparation phase, you co-created when teaming up patient-doctor pairs, which I find it a very interesting idea as well, and a blueprint also for other projects. Later on also, when you disseminate it, you share with the wider community so that it could start making use of it. And this was also possible. I could identify several enablers. So you had a culture and a governance, both in the ERN, RECONNET, and in Lupus Europe, that supported this collaboration since the root, since the beginning, between the patient representatives and clinicians as equal partners. And also you had clear processes in place, which is not always for granted, and also a dedicated person, a project manager who was very knowledgeable as well on patient engagement. And finally, more into the concrete, I think you've achieved great results, as we saw for Lupus 100, but of course also for Lupus GPT and Easy Lupus, because what you have now, it's a reliable tool, clinical validated, accurate contact. It's accessible as well because it's in lay language, even for visually impaired people, as we saw when we navigated it with the voice. You can use it also in several languages and ensuring cultural sensitivity. It's up to date. As you say, it keeps evolving, and as patient needs change as well. And it shows trends and the gaps, which are very important. And then, as Eric mentioned, I think it's also a powerful communication tool with your community. And all of these would feed into the wider goal of patient partnership in the ERNs, but in healthcare, in rare disease in general, which is to collaboratively improve the lives of people living with a rare or complex condition, and taking in consideration their needs and responding to them. And that's why we are all here today, I guess. So I just wanted to thank you again, Jeanette, Zoe, Alan, and Eric. It was very inspiring hearing to you. And also, I will keep in mind Zoe's prompt about don't wait for perfection, just do it. I think this is great. I'm also impressed how you have integrated IA to meet the patient needs. So definitely very inspiring to me, I hope for everyone. And thank you everyone once again for being here today with